Physiotherapy. Well, if we look at the emblem of the Chartered Society of Physiotherapy, there are three pillars. There's electrotherapy, there's the hands and manual therapy and forms of touch, and then there's exercise and rehabilitation. So those are the three pillars. Throughout the time of physiotherapy as a profession, which is over 100 years old now, there's been different trends. Back in the 70s, it was very much electrotherapy and ultrasound, and that's fallen by the wayside slightly. But then it moved into a very strong manual therapy phase, which was very much the era when I trained. And now we're a little bit more focused on exercise and rehabilitation. Like most things in trends, I think people can swing too far into one viewpoint, and mine has always been, look, there's a place for all of it. There's a place for ultrasound just used very, very occasionally, and certainly manual therapy, hands-on. I mean, touch has been used since time began in lots of ways, and to suggest that we shouldn't be using manual therapy, I think is wrong. There is evidence out there that manual therapy in combination with rehabilitation is effective in the management of back pain. We just need to use the right techniques, and we need to be prepared to work with the patient long enough. What's the difference between an osteopath, a chiropractor, and a physiotherapist? Physiotherapy is the only one that works within hospitals, and we have the broadest training, and we train very broad and then focus later. What most people don't realise is that physiotherapists will train, yes, in sports injuries, musculoskeletal. 2/3 of what we do in this practice is back pain and neck pain, and we use hands-on treatments for it. We're very known as a practice for using our hands, where many these days are not. But also treating in paediatrics, burns, plastics, mental health, neurology, amputees, surgery, orthopedics and rheumatology, joint replacements, hip replacements. Pretty much any area of medicine that you can think of has physiotherapy in it. And I think that if we're going to be holistic, if we've really worked in paediatrics, worked with developmental issues, psychological development, and we've looked at all of those things, and we've worked with all of these other conditions, I think it gives us a really rounded understanding of the human being when we start to look at things holistically and stop thinking of things as bits and parts, and I'm treating a knee, I'm treating a shoulder. You're never treating a shoulder. You're treating an entire person with an entire story and an entire history, most of which has usually got some connection somewhere. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.